We are so excited. For the next hour, we will have an amazing, groundbreaking, actually, seminar by Dr. Karen Herbst. First of all, we know you're logging on right now, and we welcome you to our celebration of Lipedema Awareness Month. Now, I have to say, LymphaPress, we celebrate lipedema awareness all year long, and we are committed to the lipedema community. We had the first pneumatic compression device cleared by the FDA for the treatment of lipedema, and it's so gratifying to hear the kind of results that these patients are getting using their LymphaPress. I have to say, though, I'm a total fangirl when it comes to Dr. Karen Herbst, and for good reason, because not only is she the preeminent researcher and thought leader in this space about lipedema, I've seen personally how she genuinely cares and has such a heart for these patients. Her background is immense and impressive. She's an endocrinologist, expert in Durkheim's diabetes, metabolism, but lipedema, she is the champion for the lipedema population. Currently, she is affiliated with Dr. Jamie Schwartz and Total Lipedema Care out in California. Dr. Herbst, we are so excited to hear about this new presentation, Mind, Body, and the Matrix. And we don't have Keanu Reeves here, do we?
No, we don't, darn it.
Darn it, but we have you and we are thrilled. And so without further ado, I'm going to ask you to take it away.
Great. Thank you so much, Brenda, for the invitation to speak, and also to Eric and the other members of LymphaPress who've been so supportive over the years. And I just want to say I'm with Total Lipedema Care in Beverly Hills, but I also have an office open here in Tucson, Arizona, if you'd like to see me here. So without further ado, here are my relevant disclosures for this talk. So first, let's start off by talking about lipedema, what it is in a nutshell. So it is a disproportionate deposition of fibrotic subcutaneous fat, which by definition is loose connective tissue, leading to a symmetric enlargement of the lower body and the arms. And it almost exclusively affects women. So I'm going to say women throughout the presentation, recognizing that there may be some men out there with lipedema, and you also fit into what we're talking about, but most of the studies are on women right now. The lipedema tissue is hypersensitive. Often there's daily pain, often very high daily pain. There's easy bruising of the tissue. It's difficult to lose the lipedema fat by diet, exercise, or bariatric surgery, no matter how hard you try. And we think the location of the tissue is linked to sex hormones. One of the comorbidities common with lipedema is non-lipedema adipose tissue, or lifestyle-induced obesity. And non-pitting edema is usually present, although there can be pitting edema, especially at the end of the day or on a really hot day. And we think there's a genetic predisposition, but it's likely that there's more than one gene that influences the development of lipedema tissue. And it's not just the loose connective tissue that is affected in lipedema. I think we need to look at this as a systemic disease. And for example, we know that muscle function is reduced in women with lipedema. And this could be because that fibrosis of the lipedema loose connective tissue also affects muscle. So muscle is in a fibrotic cage and it can't function normally as it should. And so you don't get the best lymphatic pump when you exercise. And so that's a reason why we promote deep tissue therapy for lipedema and not just manual lymphatic drainage, although I believe that is very important too in the treatment of lipedema. And lipedema is often confused with lymphedema. And in my opinion, lymphedema often coexists with lipedema. And we know this because of a lot of the nuclear medicine lymphangioscintigraphy exam data, especially that out of Spain, showing that the lymphatic system is affected even in early stages of lipedema. And so what I've started to do is I've started to stage lymphedema along with lipedema. And I spoke to Steve Dean the other day. He's a vascular medicine specialist, very good friend, knows lipedema very well. And he agrees. He also stages lymphedema with lipedema. And the two most common lymphedema stages that I see are stage 0, where you don't see a lot of swelling, but you feel heaviness in the limb. And I hear this all the time. My legs feel so heavy, or my arms feel so heavy, and there can be aching and a feeling of tightness. So that would be lymphedema stage 0. I also often hear that at the end of the day, you can see swelling in the ankles, or there can be swelling in the ankles after a car ride or a plane ride. And this can pit or not pit, and it's to resolve with elevation or sleeping overnight. So that's lymphedema stage 1. And then in stage 2, that swelling does not resolve anymore with elevation or sleeping overnight. And then we rarely see stage 3, although I have seen it, but again, very rarely, where there's an overgrowth of the skin and a lot more fat deposits. And when lymphedema occurs with lipedema, we call it lipolymphedema. The pain in lipedema tissue I mentioned is often daily, and it can be very intense. And the question is, why do women with lipedema have a lot of pain compared to people with lymphedema? And Angst et al. Used the short form 36, which is a quality of life questionnaire, to try and distinguish between lipedema and lymphedema. And they were able to do that specifically by pain. So by the pain questions on the SF-36. So I think this is a really good start for helping us better understand how we can tease apart lipedema and lymphedema from one another, although they do occur together. So what I often do when I have a publication on lipedema is I show a picture of a woman with lipedema, and we don't show the head. And that's mainly just to protect that person with lipedema. And we don't want to violate HIPAA, even though we have consent to use the picture. But I think that does a little bit of a disservice to people living with lipedema, because it suggests that the mind, the head, and the body are separate, and it only focuses on the body. So I think that we need to now think more about what's going on in the mind, what's going on in the body, and how they're connected. And we know for sure there's a mind-body connection. They're not separate entities. They are intimately intertwined. We know that our body chemistry and our biology impact our mood. For example, when we have a woman for menses every month, that certainly affects her mood, emotions, but it can also affect how you think and your belief system. And when we worry and stress about things, this can cause our muscles to tense. It can increase pain, cause headaches and stomach problems. So I think Joanna Dudek put this very nicely in her recent publication, where she showed that the increased symptoms that are experienced by women with lipedema, including fat tissue pain, joint pain, muscle stiffness, muscle pain, leg heaviness, and swelling, increase the risk for the development of depression, and this leads to a decrease in quality of life. Well, how common is depression in lipedema? So here are some estimates on the number of women with lipedema that are affected by depression and anxiety, and this is actually quite high. So up to 35% with depression and close to 30% with anxiety. And there may be more. It kind of depends on how you ask about anxiety and depression. So I think a lot more research needs to be done in this area. And there are also a number of other papers, which I'm not showing here, that also report rates for depression and anxiety. And again, these two mental health issues can lead to a decreased quality of life. I want to introduce this concept of interpersonal sensitivity, if you haven't heard of it before. And by definition, interpersonal sensitivity is elevation of awareness or sensitivity to the behavior and feelings of others. So it may be a high sensitivity to perceived or actual criticism or rejection. And you hear about the highly sensitive person, or you hear about people who are empaths, who have a lot of empathy. They likely have interpersonal sensitivity. Interpersonal sensitivity may be one of the vulnerability factors leading to depression. and it is an underlying personality trait in anxiety disorders. So Angst et al. Looked at another questionnaire called the Symptom Checklist 90 Revised, or the SCL90R. And some of the questions on this questionnaire are very good for figuring out whether a person has interpersonal sensitivity. And they compared the scale between women with lipedema and people with lymphedema, both men and women. And what the outcome was that women with lipedema scored lower, so they had more symptoms. So interpersonal sensitivity may be a source of depression and anxiety in women with lipedema. Back in 2015, we published that women with lipedema often have joint hypermobility syndrome or hypermobile Ehlers-Danlos syndrome. And it turns out that people with these symptoms are up to 16 times overrepresented among those with panic or anxiety disorders. So in other words, anxiety is highly linked to hypermobile joints. And hypermobility is also linked to stress-sensitive psychosomatic disorders, including irritable bowel syndrome, fibromyalgia, chronic fatigue, and is also associated with hypersensitivity to the sensation of pain. So could pain in lipedema tissue be related to hypermobile joints and the hypersensitivity of the tissue that confers? And also, hypermobility is linked to interpersonal sensitivity. So do you think women with lipedema have high interpersonal sensitivity? I would love to hear what you have to say. Let's move on to psychosocial stress. So what is the definition of psychosocial stress? Well, we just went through a pandemic, so we've all been through psychosocial stress. It's the influence of psychological factors, so in your brain, and the surrounding social environment, what's going on around you, on your personal physical and mental wellness and your ability to function. And psychosocial stress results when we look at a perceived social threat in our lives, whether it's real or imagined, and we discern that it may require resources we don't have. So we know that there are a lot of challenges for people living with lipedema. People with lipedema, I think, have a lot of psychosocial stress. They have a chronic and in many cases a progressive disease. They physically have mobility impairments. They can have trouble finding clothing and shoes. Because of the amount of lipedema tissue they have, or even lymphedema, they can have impaired activities of daily living and recreational limitations, especially swimming. I hear a lot that women just don't like to put on a bathing suit and go out with friends. There's also a higher potential for illness like obesity, lymphedema, cellulitis, arthritis. Financially, it may be difficult. You may be limited at work because you need to elevate your feet. There's a high cost of care, and you may be far from getting care from a particular provider. And there's also still quite a few healthcare providers that don't understand the disease. And I don't mean to belabor this, but in talking with ladies with lipedema lately, these are things that I hear often. They've tried so many diets, exercise, nothing seems to work to make the fat or edema better. They are living with physical pain and discomfort on a daily basis. And they are very concerned their condition's going to worsen and they might lose mobility and end up in a wheelchair and bedridden. And I hear this from ladies who have early lipedema as well. There's just a high fear factor associated with the development of lipedema. And there's a lot of self-judgment and self-blame. And there's that emotional roller coaster when you hear, oh, there's something I could try and this might actually help me, but then a feeling of hopelessness when it doesn't work for you. And I think a lot of my patients feel separate from and different from others, and they feel embarrassed because of the way their body shape is or by how they feel, and they feel powerless to change the situation. That's definitely psychosocial stress. And we know there's many options for treating lipedema now, but which one do you choose? And how much does it cost? And which provider do you go to help you pick the right thing? So even though there's more choices, which is good, that actually in and of itself brings along with it psychosocial stress. And we know there's a weight stigma in our society, and that And stigma means that there's a disgrace associated with a particular circumstance or person. So a disgrace associated with the development of lipedema tissue. And you can see right off the bat, that leads to stress. And that stress actually can lead to increase in cortisol, stress hormone levels in the body, and inflammation. And of course, it leads directly to psychosocial distress and physiological distress as well. And I'm sorry that women with lipedema have to face weight stigma in our society. So I'm going to redraw Joanna Dudek's conclusions from her paper and say that hypermobile joints in women with lipedema can directly lead to depression and anxiety, but also lead to symptoms associated with lipedema. And along with those symptoms, psychosocial issues and interpersonal sensitivity, this can lead to depression and anxiety and a decreased quality of life. And what's really interesting is Dr. Sean Hill, he's the director of the Center for Neuroinformatics in Canada, one of the largest mental health teaching hospitals in Canada. And he says, fundamentally, we don't have a biological understanding of depression. So we know what it is, we can identify it, but we don't really understand what it's doing in the brain. Well, this paper came out this year showing that depression actually raises inflammation in the body. So what we're saying is the symptoms of lipedema can lead to depression, which then in turn raise inflammation markers in the body. So people with major depression have elevated CRP levels. CRP is called C-reactive protein. It participates in inflammation and repair. So inflammation might be present in depression because it is a core biological component. So when you have depression, you have inflammation, and inflammation is part of the activation of stress-related molecular pathways, which I'll go into. So what's the mind-body connection in lipedema? So we know for sure that macrophages are increased in lipedema tissue, and this has been shown by two different groups now, and actually was shown by Dr. Foldy from Germany years ago. And you can see that the elevated macrophages are in women with lipedema who don't have obesity, but also in women with lipedema who do have obesity. So it's not just obesity causing the rise in macrophages, because we see it in the absence of obesity. It's inherent in the lipedema tissue. And we see the same thing in lymphedema. And they think that the macrophages in lymphedema are trying to reduce down that fibrotic tissue, but they also may play a fibrotic role by activating fibroblasts to lay down scar. So there is help on the horizon. This little guy is a salamander axolotl, and when this salamander is injured, they can regenerate their body parts, and they do this by using macrophages. So the author of this article said, I envision being able to use a topical hydrogel at the site of a wound that is laced with a modulator that changes the behavior of human macrophages to be more like those of the axolotl, so that the macrophages would, instead of causing a scar to form, they would actually go on to regenerate and heal the tissue. So can you imagine being able to apply a cream at night for your lipedema tissue and having it better in the morning? How great would that be? So I'm very excited to follow this research. I mentioned that depression can lead to inflammation, and also that lipedema tissue has inflammation. So it's my opinion that inflammatory diseases can contribute to the development and progression of lipedema tissue. And these diseases include allergies to the environment and food, mast cell activation disease, inflammatory vein disease, psoriasis, non-lipedema obesity, having a period every month. Yes, that is an inflammatory condition. Prediabetes, a car accident, trauma, sleep apnea, surgery, and depression. So I think we need to not only just focus on the inflammation that's in the lipedema tissue itself, but to look at the whole person and ask what other inflammatory conditions do they have that could influence the lipedema tissue. This is a cartoon of the brain and immune system. And you can see over here on the left side, when there's stress, it actually directly leads to the stimulation of corticotropin releasing hormone from the hypothalamus. That then activates the pituitary to secrete ACTH, which goes to the adrenal gland, which secretes cortisol, and that suppresses the immune system. But at the same time, stress activates CRH, which goes to the locus ceruleus in the brainstem to activate the sympathetic and parasympathetic nervous systems. And the sympathetic nervous system is a pro-inflammatory. The cortisol is anti-inflammatory. If you have a lot of stress over time, you can actually cause the adrenal glands to fatigue and the cortisol levels can drop, leading to increased inflammation in the body due to the sympathetic nervous system. And CRH also activates mast cells directly to release histamine, which causes swelling. So you can see that now there's a direct link between stress and swelling. Now we know that lipedema is a loose connective tissue disease, and that just got published in our Lipedema Standard of Care in the US paper. And loose connective tissue is all over our body. And there's different layers shown here. The green is actually an anchoring layer, a thick anchoring layer. And then there's some areas that are only a single layer, like in yellow, and other layers that are 2 layers, like in red or blue. And the loose connective tissue on our body is directly innervated by the autonomic nervous system, both the sympathetic nervous system and the parasympathetic nervous system. And this is what the lipedema tissue looks like. The open circles are the fat cells. In between the fat cells are a space called the extracellular matrix. And in there are fibers, cells, and a gel made up of proteoglycans, which I'll describe a little bit more later. And in here also is fibrotic tissue and immune cells, which are these little black dots in here. So this tissue has experienced inflammation and fibrosis. We see the same thing in lymphedema. So this is an example of lymphedema tissue. You see the fat cells, but you also see a lot of fibers here in pink. That's the fibrotic tissue, as well as a gel. And that gel is in balance with liquid in the tissue. And if there's an imbalance, there can actually be too much free fluid, or there could be too much gel. And when there's too much gel, there's poor flow through the tissue. So we are anti-jello. What makes up that jello are proteoglycans, and proteoglycans are a protein backbone to which glycosaminoglycans are bound. And these glycosaminoglycans are repeating sugars, so just sugar molecules. There's also a special glycosaminoglycan called hyaluronin or hyaluronic acid, which is present in a lot of beauty products. And proteoglycans, so protein backbone glycosaminoglycans can actually bind to hyaluronic acid, forming huge proteoglycan complexes. And water, shown in the blue circles, and sodium or Na+, bind to these proteoglycans, forming that gel. And so this is what we're working against with our compression garments, with our sequential pneumatic compression pumps, with our exercise, and with our manual therapy, to make this gel more of a liquid or a sol so we can move it out of the tissue. This is a cartoon of the extracellular matrix here, shown in blue. And here's the heart. It pumps fluid down to the level of the tissue, and it releases fluid and nutrients into this extracellular space. Anything that does not leave through the capillaries actually gets taken back up to the heart as part of the venous system. And the fluid within the matrix must leave through the lymphatic vessels, shown here, where it's then returned back to the vascular system. And I want to point out here these little pink blobs here. That is a nerve in the sympathetic nervous system or the parasympathetic nervous system. So these nerves interact directly with the extracellular matrix. They sample what's going on so they can take in information, and they can also modify the extracellular matrix by secreting things into the extracellular matrix. And this is all from the brain. The brain is sending these signals down to the tissue and receiving signals from the tissue. There are also viscerosensitive nerves in the tissue that let you feel what's going on in the extracellular matrix. And I swear, whenever I eat ice cream, I can feel my butt growing. And I think that's this viscerosensitive nerve telling me that the fat is going into that specific area. Would love to hear what you have to say about that. So let's look at this from the position of stress. So when you have stress, as we showed before, the autonomic nervous system gets activated through CRH and the brainstem. These autonomic nervous system axons release mediators, including interleukin-1 or substance P, which then activate mast cells to secrete histamine, resulting in swelling, inflammation, and fibrosis. And when that fibrosis is around the nerve endings, the brain perceives it as pain. So could this be why people with lipedema feel pain? Is because there's fibrosis directly in the area of the autonomic nervous system nerves. Just something to think about. So why does inflammation continue on in lipedema? Why can't our brain send messages down to our tissue and squash that inflammation? Well, the reason is when an area becomes inflamed over a long period of time, those sympathetic nervous system fibers withdraw from the tissue. So the brain, which is trying to reduce the inflammation, can no longer do it because it's uncoupled from the tissue. And this is called a zone of permitted inflammation. So lipedema tissue is a zone of permitted inflammation in many cases. So I prescribe sympathomimetic amines to my patients with lipedema. These include phentermine, dextroamphetamine, Adderall. Some patients are also on Vyvanse. And the reason is because these medications activate the sympathetic nervous system and they help improve lymphatic pumping. They reduce fat in the fat tissue. And 90% of my patients with lipedema said it benefited their lipedema tissue. They lost weight, they lost clothing size, but their lipedema tissue still stayed. I could get rid of all the other fat, but not the lipedema tissue. Could this zone of permitted inflammation due to retraction of the sympathetic nervous system be a reason why the lipedema tissue does not respond to sympathomimetic amines? This is a paper that came out this year on the Mediterranean diet for people who don't have lipedema, which they called controls, or people with lipedema, all women, where they called them lippy. I did not do that, that's them. And they were able to show that after 4 weeks of the Mediterranean diet, that both groups lost weight, which is great. That's exactly what we want. The weight loss was a little bit more significant in the group that did not have lipedema. But look at this data. The people without lipedema lost weight in almost every area of the body. So the percent of fat decreased in the entire body, except maybe not the arms as much. But in lipedema, there was no decrease in the percent of fat on the body at all. So again, you can lose weight, you can lose, quote unquote, normal fat when you're on a diet and you have lipedema, but it's very difficult to lose the lipedema fat by diet. And I think this is a very nice study because it actually proves that. So the sympathetic nervous system, as I mentioned, is directly linked into fat cells. And fat cells respond to circulating norepinephrine that binds to these receptors on the fat cells, and it responds to the sympathetic nervous system, and it causes the release of fat. Well, this is what we need to have happen in lipedema. But if the sympathetic nervous system has withdrawn away from the fat tissue, then the adipocytes are no longer going to respond by releasing fat, and they're going to hang around for longer than we want them to. This is a interesting paper, and this is an area that requires more study in lipedema, including by myself. But what it shows is that in men or postmenopausal women, that the sympathetic nervous system is activated. It's going. And it likely is doing this because of the release of the hormone leptin, which directly stimulates the sympathetic nervous system. And if your sympathetic nervous system is on too much, then the receptors in the tissue, as I showed before, downregulate. They disappear. They're not available anymore. And when that happens, then the adipocytes start to grow in size. They become hypertrophic and big, as we see in lipedema. And you make more fat cells, as we also see in lipedema. And that results in inflammation and vascular dysfunction. So could this activated sympathetic nervous system be important in women with lipedema? And I think that remains to be tested. And what's really interesting is you see postmenopausal women on the slide, but what about premenopausal women? Well, premenopausal women don't activate the sympathetic nervous system. So it doesn't make sense that it would be part of the pathophysiology of lipedema, except when the sympathetic nervous system gets activated in premenopausal women is when estrogen levels are highest. So during that cycle of the menstrual cycle, during that point where estrogen levels are very high. So we've all been saying hormones play a role in lipedema, and this may be our first insight into how those hormones, along with leptin, activate the sympathetic nervous system when a woman is having her period, and also when a woman goes through puberty, and also when a woman's in pregnancy. It doesn't explain menopause, but I think menopause is separate. And the authors of this paper recommended taking curcumin, using cold therapy and exercise to deactivate the sympathetic nervous system to stop this madness. Now, we saw that in men, I think we clearly understand that when men develop obesity and have increased leptin levels, they definitely activate the sympathetic nervous system, leading to inflammation. But look at all the question marks in the data on women. So a lot of the data is coming out of studies on men and not studies on women. So we need a lot more research into this area, which I think will help us link sex hormone levels to the sympathetic nervous system and inflammation in lipedema. So let's change our diagram again. We've got hypermobile joints leading to symptoms and depression and anxiety. We've got lipedema, fat tissue producing leptin, and along with estrogen that leads to inflammation. So do other comorbid conditions lead to inflammation. And all of this leads to a decreased quality of life. So it's not stress that kills us, it's how we react to it. So how do you reduce stress? Would love to hear comments about things that you can do that reduce down your stress to reduce down that inflammation and fibrosis that all of us can develop in our fat tissue. So there are mantras, I think, that are very important. And I had a patient of mine say that she's got a mantra and she says, you know, I love myself, I love my body. And when she said that, she cried. So that's a big deal, to love yourself. It's difficult for many, many people, not just those who have lipedema, but I think it's important for you to give love to your body. And this is just a short list of mantras. I'm sure that you can suggest other mantras that you use to reduce down your stress level and love yourself. This is I can move this. I can't even see the top of my screen. There we go. Ho'oponopono is a Hawaiian word for correction and also for mutual forgiveness. And using these simple words below, there's a number of stories of how these words actually helped relieve people of their stress and maybe stress-associated diseases. And thank you, Joanne, for introducing me to this. But the words are, I am sorry, please forgive me, thank you, and I love you. And I would love if everybody could say that to their body right now. And you don't have to just have lipedema to say these words, that I'm sorry, please forgive me, thank you, and I love you. And there's a woman named Morna Simeona, and in 1976, she added on the end of it, and it is done. And I think that's very important. When you say these words, you say, and it is done, meaning, yes, I have actually forgiven myself and loved myself. Tapping is a very powerful stress relief technique. It's also called emotional freedom technique. It's based on Chinese acupressure and modern psychology. And tapping helps to lower stress hormone levels in the body and improve immune system function. Just exactly what we've been talking about. And it's free. You bring your hands with you everywhere you go. and tap. There are different tapping points. And as you tap, you can tell yourself that you love yourself and you love your body. You love everybody else. Weighted blankets. These are therapeutic blankets that weigh between 5 and 30 pounds. They've been used a lot in the veteran population for PTSD. And this pressure from the extra weight of the blanket mimics a therapeutic technique called deep pressure stimulation. And deep pressure stimulation can reduce autonomic arousal. So that's the activation of the autonomic nervous system, including the sympathetic nervous system and the parasympathetic nervous system. And this arousal is responsible for the symptoms of anxiety, such as increased heart rate, palpitations, and other signs of anxiety. Compression clothes are like a hug. They improve circulation, both blood and lymph. The pressure provides comfort, and it improves walking by smoothing the tissue, thereby reducing stress. And exercise. Any exercise reduces stress. Don't do that exercise, pick another. So walking, swimming, whole body vibration, yoga, being on elliptical, tai chi, really anything you want that you want to do on a regular basis. And cold, we talked about cold therapy as a reason to slow down the sympathetic nervous system. What cold does actually is stress your body. And why would you do that when you're trying to decrease stress? But you want to activate your stress pathways. So you do get into a stressful psychosocial situation and you have high interpersonal sensitivity. You want your stress pathways to give you strength to calm everything down. And so using cold to decrease inflammation, but also to reduce activation of the sympathetic nervous system when you're done is actually a good idea. And I know a lot of ladies with lipedema who have used cold therapy. You just have to be careful. If you have numbness of your tissue and you're in a cryo chamber, you don't want to touch the side and not be aware of it. Social connection, like we're doing now. Social connection reduces the impact of not only your genetically induced anxiety, like that which may come along with hypermobile joints, but also the environmental stressors around you. And we know that stress activates the hypothalamus, the pituitary, and the adrenal glands to secrete cortisol. It also activates the autonomic nervous system, and being socially connected as we are today actually reduces all of that. So thank you for being here. Sequential pneumatic compression pumps. I have talked a lot about pumps before. I'm a big supporter of pumps, and we actually recommend the use of sequential pneumatic compression pumps for the treatment of lipedema in our standard of care paper. And compression from a pump can be like a hug to reduce anxiety. We know it also reduces pain, improves lymphatic flow, thereby reducing edema, and edema leads to inflammation. It helps move the gel out of the interstitial matrix, and it also is known to reduce fibrosis. So pumps actually accomplish a lot of what we want to accomplish, and many pumps are covered by insurance, and they allow you to treat yourself at home, which is really important during a pandemic or when you have poor access to care. It's too far away, unavailable. Electricity is something that I think we should think more about. And I've listed a bunch of papers here about electricity and how it can affect the pathophysiology of lipedema. So for example, mild electrical stimulation has been shown to reduce fat. Well, if we all put on a TENS unit, why aren't we all super skinny? So it's not as easy as just putting electrodes on and reducing fat, but I think we need to look more into it, because there's also a review of the literature showing that microcurrent reduces fat. So how do we make this happen in lipedema? And if you stimulate the vagal nerve, it actually helps control weight. And there are some vagal nerve stimulators available on the market, and I've been thinking about a vagal nerve stimulator for years. So it would be interesting to see if anyone would try that and what happens. And then there's something called pulsed electromagnetic field. And this improves connective tissue healing by decreasing inflammation and thereby fibrosis. And pulsed electromagnetic field is is just electromagnetic energy that we get from our computers, from our television, but it gives it to you in a very pulsed manner and at a very low level. And you can actually get whole mats that you can lie on. And I've been recommending that for my patients, and I've had some very good and interesting outcomes. And then finally, electrical stimulation improves lymphatic flow. So why would we not use it? So we got to figure this out. Maybe we'll make a pump with electricity. So in conclusion, the mind and body are both important in lipedema. And we know that lipedema affects the mind, but also muscle and loose connective tissue. So it's a systemic disease. It's not just a disease of loose connective tissue. The development of depression and anxiety in people with lipedema is likely multifactorial, including from the lipedema tissue itself. So if you have depression or anxiety, don't beat yourself up about it. It's not a weakness that you have. It actually could be because of the hormones that are being released by the lipedema tissue itself or through hypermobile joints. And so if you have depression or anxiety, please seek help, either through your social connections, your friends, your family, or through a healthcare provider. And if you do have high interpersonal sensitivity, which I know a lot of you do, and I have it myself, I think a loving mantra is important, not only to forgive yourself, but also there's some really nice people out there in the world, but there's some not so nice people out there in the world. And if you're very influenced by the mood and feelings of others, you need to protect yourself. You need a good mantra to remind yourself that you are loved. I think that lipedema tissue may be activating the sympathetic nervous system, generating inflammation in the body and the mind. And it may do this in the postmenopausal period, but also in the premenopausal period when estrogen levels are high, and also in puberty and pregnancy. So I think this is finally at least one insight into a connection between the sympathetic nervous system, sex hormones, and lipedema. And we don't really understand the pain in lipedema yet, but could that fibrosis that develops around the autonomic nervous system and maybe our visceral nerves and lipedema tissue be the brain pain signal? And it may explain why it's so high in people who have lipedema, because so much of the loose connective tissue is fibrotic. So our goal should be to reduce inflammation from all sources, so lipedema and others. So whether it's sleep apnea, try to get it treated. If you have psoriasis, try to get it treated. If you have allergies, try to stay away from the allergens that cause reactions in your body, and work with a good allergist or immunologist, because we want those sympathetic nerves and their receptors to be very active in the tissue so that we can allow our brain to reduce inflammation in our tissue. If they withdraw or if those receptors downregulate, then we have areas of permitted inflammation in the body. I think reducing stress to decrease inflammation is another reason to exercise, compress, and pump. And I'm very hopeful that some salamander research will help us. And finally, I think we should be looking more into electricity to change that gel in the matrix to a sol, to a liquid, so we can pump it out with our compression, our exercise, and our sequential pneumatic compression pumps. And our mantra should be no jello. So thank you so much for your time. I really appreciate it.
Dr. Herbst, that was fabulous. And we have questions, and I'm also into this axolotl. We should get t-shirts with the axolotl logo, make it our mascot or whatever. You never fail to provoke thought and push the envelope and cause us to think about new possibilities. And that's what gives the lipedema population hope, knowing that there's someone like you that cares enough to say, what should we be doing about electricity? And what about this? And what about that? So let's go to some questions, if you don't mind.
Sure.
There are some names that I know from the social world, and you mentioned the importance of social connection. Yes. And a lot of these lipedema social influencers put themselves out there and face attacks from the community outside of the community, they are judged. And I applaud the bravery and the courage of these women for putting their stories out there, knowing that they're going to get some pushback from unkind people. One of the people who's joining us right now she's known as Curvy Girl Beth Reilersdam. And she asks, I know, we're all like, hey, Curvy Girl Beth's in the house. Are there mental health professionals that are joining the others to support lipedema patients? We have the medical community, researchers. What about mental health?
Yes. So Joanna Dudek is one of them. And I think she's got 3 papers out now on lipedema. And she's very interested in depression and anxiety in patients with lipedema and understanding why that happens and what we can do to help them. And there are a number of other mental health providers that are involved in lipedema care. But I think that you're right, Beth. I think that we need more involved, and I think they can help us understand the relationship between hypermobile joint and inflammatory diseases and depression, anxiety, and activation of the sympathetic nervous system. So I think this talk maybe is a call out to them to come join us and help us figure this out, because the more minds we have working on this, the faster that we are going to figure it out. And I haven't really heard lipedema talked about in relationship to the sympathetic nervous system. And it's not just lipedema, I think it's women in general. So women in general activate their sympathetic nervous systems to a higher level than in men. And so I think we need to look at that, at the literature, and not just study men. We need to study women as well and their relationship to what's going on in men.
Particularly because this is a primarily women-oriented condition. Yep. So we should be studying the women. That makes perfect sense. Kathleen Listen is out there. Hi, Kathleen. We're so glad you joined us today. And she said we should be checking our patients with lipedema about adverse childhood experiences, which is a really good point. We're so glad you were out there, and we're glad you made that point. Susan Ryan wants to know, what is the role of bioidentical hormone replacement?
Can I just step back to Kathleen for a second?
Sure.
So I do see that there are a lot of stressors that can happen in our lives along the way, and this can influence our development of stress and how we handle stress. But I want to be really clear that I don't think that a trauma in childhood actually causes lipedema to happen. And there's some opinions out there that are saying that early trauma can actually cause lipedema pain to develop. And I don't want to agree with that conclusion right now. I would like to see more data on it, because I think I showed in this talk that there are a lot of different ways that pain can develop. And I don't want us to step back into the dark ages of lipedema and say, oh, women are hysterical, and that's why they develop lipedema and pain associated with lipedema. And that same group is also saying that basically women with lipedema are just obese, and we just need to send them to bariatric surgery. And they show pictures of how women have lost weight after bariatric surgery, and they're labeling them as lipedema, but they don't fit the lipedema definition. So as much as I agree with you, Kathleen, that we need to understand all the sources of stress in our patients, and we need to help them, find ways to reduce that. I just don't want to say that it's a cause for lipedema.
Well said, Dr. Herbst. Could you address this question about the bioidentical hormone replacement in lipedema?
So believe it or not, there's absolutely no data on hormone replacement or birth control pills or bioidentical hormones in women with lipedema, not one drop or iota. I hope somebody's actually working on that. But I have had women who have been with lipedema, who've been on the birth control pill for years, and they did not notice a lot of change in their lipedema tissue from taking the birth control pill. And again, that's all anecdotal data. I have no data. I don't even know what to say. But let's think about how we replace hormones in men and women. If we replace testosterone in men, we monitor testosterone levels. If we give a woman a birth control pill or hormone replacement therapy in the menopause, we don't monitor it at all, which doesn't make any sense to me. And so what I guess I like about the bioidentical hormone field is that once they give you hormones, they monitor you. And they're going to make sure that you're not going to be hugely estrogen dominant or hugely progesterone dominant. And we know from data out of Italy that there's a gene associated with lipedema that when it's mutated allows progesterone levels to rise. And when progesterone levels rise, fat tissue increases. So I think it's important to monitor hormone levels when a woman is on hormone replacement therapy of any kind, whether it's traditional allopathic or bioidentical. And I think the lower level hormones are good, but it's all dependent on how you metabolize your sex hormones. So what may be a low level in one person could be a high level in the other. And again, it just brings us back to, shouldn't we be monitoring sex hormones in women with lipedema if they're so important in the development of the disease?
Excellent. One thing I didn't mention and highlight as much as I should have, and you did mention it in the context of your presentation, but I think it needs to be underscored, is this standard of care document, which represented a huge amount of work and collaboration among people that are so dedicated, some who are actually on this webinar today. Could you speak for a moment about this standard of care, Dr. Herbst?
Sure. So the standard of care is a true consensus document, at least ours for us. There's some other consensus documents that are coming out of Germany that are not consensus. They're actually written by a couple of authors and they list a whole bunch of people, but it's really the opinions of a couple of authors. Whereas our paper was written with 22 people that gathered together at the Fat Disorders Resource Society meeting in 2019. And we spent an entire day together going through the other standard of care documents from other countries and going through the current literature on lipedema and talking about our own expert experience working with patients with lipedema. And we came up with 85 statements about lipedema in the standard of care paper. And those statements include everything from the definition of lipedema. We describe it for the first time as a loose connective tissue, to the underlying pathophysiology, to the medical treatment, surgical treatment, vascular treatment of both arteries and veins, and then therapy components in physical and occupational therapy, especially by certified lymphedema therapists. And everybody contributed, everybody had something to say and modified the paper over and over again. And I'm very proud of it. I can already see areas where we need to improve it, but it definitely tells the world about our opinion on edema in lipedema tissue, that there is edema, but you have to really understand what edema is. And it's not just free flowing fluid, it's fluid bound up as a gel as well, which you saw today. We talk about how lipedema can be present on the abdomen. We talk about all the comorbidities associated with lipedema and how we suggest they should be cared for, and so on. And it's definitely something I'm very proud of, but I'm also just super honored that I got to work with so many people and we worked together so well as a team. It was amazing. We didn't have any drama really throughout the whole thing. And that's what you really want. We were just focused on writing the best data that we could to move the field forward, but also to support our people living with lipedema and healthcare providers and help more healthcare providers understand lipedema and care for patients with lipedema.
In fact, some of the chatter from our guests today is saying, can you send me the standard of care? We promise everybody that's registered, we will send you the standard of care. We'll send you a link to the replay, because this is groundbreaking information that you're going to want to share with the teams of people you work with, and to equip you to better serve your patients, and for the patients out there as well. Do you think that standard of care is something that they could walk into their doctor with and say,
absolutely.
because,
Absolutely.
yeah,
We paid for this paper to be open access. So if we didn't pay, it would be closed access, and you would have to get a subscription to get it. And we didn't want that. We wanted this to be spread far and wide as we could, and we wanted everyone to have access to it. And it's so well referenced. And each statement, we give our opinion on how strongly we felt about that statement, and how well those statements were supported by the literature, so that providers can say, oh yeah, this group really feels strongly about this, but it looks like more research needs to be done in this area. And we also, at the very end, talk about research areas that we felt were important. But I think it's the best white paper you could possibly bring into the office of your provider. Pretty big, it's pretty long, but every statement is carefully separated from each other and very, very clear. It's very well written, because as a group, we worked so hard on that.
I know one of the authors with you is Linda Ann Kahn. She is a friend of LymphaPress. She often attends our roundtable discussions. And I do want to mention that, because I know time is wasting. And if we can keep you for a few more minutes, Dr. Herbst.
Absolutely.
Wonderful. So we will get to everyone's questions, but we believe in social connection and supporting the lipedema community. And every third Wednesday of each month, we offer a free webinar where all the top social influencers in the lipedema world are there, and medical professionals, people like Dr. Lindy McCutcheon. Occasionally, Dr. Herbst shows up, Linda Ann Kahn, and we have great discussions that cover everything from pneumatic compression to vibration plates and compression, and dating and lipedema. So please do visit lymphapress.com, and we'll send the link as well in the follow-up to all attendees today and registrants, so that you can join us for the next roundtable discussion. Speaking of which, Lisa Costello out there wants to know, can you please explain vibration therapy and how it benefits lipedema?
Sure. So just to preface, there are no studies on lipedema and whole body vibration therapy, but whole body vibration is when you sit on a platform, the vibrations move from the platform up your body, and those vibrations have been shown to improve lymphatic flow, improve blood flow, build muscle, build bone, and likely reduce fat, although you have to have a really long study in order to see actual fat reduction. And actually, Dr. Vader, who was one of the inventors of manual lymphatic drainage therapy, said that it's a good idea to vibrate the tissue before you do the manual therapy. So vibration can come in different forms. It doesn't have to be a platform. It can actually be a handheld vibration device as well that you can move around your body. And then muscle massagers are kind of in the same spectrum, because they're repetitive movements in the tissue.
Excellent. And there are many tools in the toolbox, and I love how you talk about all of them. It's not just one silver bullet that really is the answer, but a combination of things. And then the thought-provoking information you've provided today about the stress relief and the self-acceptance. These are huge, huge issues. Anna Pozzoli wants to know about supplements. She says she didn't see that in the standard of care. Are there any broad brush statements you could make about supplements, Dr. Herbst?
We had a word limitation. So there are a lot of things that were not included in the standard of care, but we are going to expand the standard of care into a much larger manual. And so we will definitely be adding more supplements into that larger manual. But in the standard of care, we did mention diazomin as a supplement that improves lymphatic pumping by decreasing inflammation. And I think other anti-inflammatories can do something similar. It's just that diazomin is quite well studied. So you're right. We didn't have a massive list of supplements because that would have exceeded our word count. And we wanted to pick statements for this particular paper that would have the biggest impact. And since there are so many supplements, that it would have been difficult to review all of those, but that definitely needs to be done.
Excellent. Lori Pelnitz says something that I have heard repeatedly from the lipedema population. It's one thing to try and get better, but the last thing they ever want is to get worse. Are there any things that lipedema women should absolutely avoid that make their condition worse?
So stress. If we could all avoid stress, wouldn't that be great? But that's easier said than done. In the standard of care paper, we do make some recommendations in the medical section on medications to avoid. And some of those medications include medications that increase the risk of developing more fat tissue, medications that increase the risk for you to develop more edema. And so I think that bringing that paper into your provider and showing them those two things would be really important. And then we also suggest to avoid diuretics, the use of diuretics, if you can at all help it. At some point, it can become unavoidable in lymphedema. But what diuretics do is they concentrate the gel in that interstitial matrix. And they keep, there's a hummingbird looking through the window. Hi.
How lovely. What a nice sign.
I know, I think so too. It's not a salamander, but it's a hummingbird. But if that gel starts to get more and more and more thick and concentrated, it's going to be impossible to get it out over time. And that's what diuretics do. And they make you dependent. Diuretics make you dependent on them, and you have to increase the dose. So we do say some things in that standard of care paper to avoid so that you don't make the lipedema worse.
Back in the day, I was talking to Patty Cornute of Lipedema Fitness, and she was actually advised not to exercise back in the day because she was told it would exacerbate her condition. How glad she is that she disregarded that advice and listened to her body. And I also love how you said, Dr. Herbst, it's not one size fits all. Every woman's body is different. And what may work for one person doesn't necessarily work for another, but listen to your body and be sensitive to that. And speaking about sensitivity, some people have wanted to know about this interpersonal sensitivity, which you admitted you have. I know.
Yes,
I have.
I have it.
I'm
a highly sensitive person.
Me too, but that's what makes you caring. And so there is the flip side of all of this. And that's why I think the lipedema population is comprised of some of the kindest, warmest people I've ever met in my life. They're like, I found my people. I love them. This SCL90R test, is this something that we can take somewhere, somehow and find out?
In fact, why don't we post a link?
Okay.
And then you can take it. The only thing is you definitely need someone to interpret it, because in the paper that I mentioned by Angst, they looked at different populations. And so they are comparing population means. And so you're going to be taking this on your own and talking to a provider about the results. And so that provider really needs to understand the scoring of the document. I think there were 9 questions on interpersonal sensitivity in that questionnaire, but I definitely think that would be fun to take.
And I was really glad that I was muted when you made your ice cream comment about how you feel like your body knows immediately that it's heading down the fat trail. Yes. I think many of us were nodding and laughing at that. A couple other quick questions. People want to know how to connect with good practitioners. And I hear this all the time. I'm in such and such a city. There's nobody in my city that knows or treats lipedema.
Yeah, that's one of the reasons why we put a lot of funding into telemedicine. So I could be licensed in so many different states. So I could do telemedicine with people so they don't have to travel to come out to see me. So I do a lot of telemedicine in different states, and I'm hoping other providers can do that too. There's a compact of 15 different states, and you pay a fee to be allowed to get licenses in all those states, and you still have to pay their license fees as well. But I hope other providers will start to do that. I think you can get some counseling, especially from health coaches or stress coaches, where that provider doesn't have to be licensed in another state. And then the Lipedema Project has a list of providers that you can look through to see if you can find someone near you. And then the National Lymphedema Network has a list. Close, the KLOSE out of Colorado, they do a lot of instruction for certified lymphedema therapists. They have a list of providers, as well as the VODR site. And then the Casely Smith also has a site, but you have to give your email. So I haven't looked at their site extensively, but there's a lot of different resources for finding providers, and maybe we should make a list of those too.
Yeah, we can. This is going to be a robust follow-up email to everybody. Leslie Sterling wrote, she's just had rotator cuff surgery. She can't wear compression because she can't pull them up. She's been able to don knee highs, but her knees, she says, look like basketballs and her thighs are out of control. We feel for you. That's very difficult. What can I wear, she says, with one hand to control everything from the waist down? It has to be easy and fast on and off for bathroom runs.
Well, you can get compression garments that are open down below so that you can actually just go to the bathroom without taking them off. That's one suggestion. I think a pair of bike short compression and knee highs would be also useful. So when you need to go to the bathroom, you just pull down the bike shorts. You don't have to pull anything off your legs. You can also have a pair of bike shorts plus knee-high socks, and then you pull a knee sleeve on top of that. So 3 different pieces to cover the leg.
Those plastic gloves that you can wear with ribbing on it are really helpful when you're trying to pull things up. And on this topic of ease of use, that is so important, because if it's not easy to use, you're not going to be compliant, and compliance is a key to have success no matter what tool you're using. And I will say that the LymphaPress, if that questioner is not familiar with LymphaPress, we would love to work with you and help. I was telling Dr. Herbst before we started today, I've been working with a woman who has wanted a LymphaPress ever since we started talking about this at our roundtables. She just got it, 2 weeks of use. She has lost 13 inches. And we were both sort of crying because she has tried everything and hasn't had results. It's easy to use. She just zips it up. And 2 weeks later, she's seen such a reduction and reduced pain, increased mobility. So these are all good things. There is hope. We want to encourage everyone that there is hope. And because there are people like Dr. Herbst on the case, there is great hope for the future of the lipedema population. So with that, Dr. Herbst, we will put Joanna Duda's information as well. I see a question about that. The question we have about micro vibration machines, does that go along with your answer on vibration in general?
Yeah, I like vibration just overall. And I think it's in that same spectrum of electricity and ultrasound. So anything that treats deeply into the tissue is good for lipedema.
Excellent. So I want to give you the platform for your closing comments. First of all, I want to personally thank everybody who logged on today and who may be watching the replay. We're glad you care about lipedema. LymphaPress cares about lymphedema all year long, and we would be honored to help you take care of your patients, or if you are a patient, to provide hope and help for you as well. Dr. Herbst, the floor is yours.
Well, thank you everybody for joining us today. This talk was kind of a new journey for me as I brought in some new concepts, and I may not be entirely right on everything, but I'm hoping that it stimulated your thinking, because our goal is to continue to move forward to improve treatment for lipedema. There is my email on. If you have an idea or you came upon something interesting, please feel free to email me. I definitely listen to everything you have to say. And thank you for joining us for this talk during Lipedema Awareness Month.
Thank you again, Dr. Herbst. Have a great day, everyone.
Thank you.
See ya. Bye-bye.